responsible for an upper trap or a rhomboid. Let me say that again. So you're only responsible for an upper trapezius or a rhomboid, that's it. All right, so that makes it easy. So an upper trap is going to be for a combo. So a combo is a combination of ultrasound and E-stim, right? So if you use an upper trap, what is the ultrasound setting for frequency?
3.3.
3 or 3, depending on the machine. If you're using a rhomboid, what is the ultrasound setting for frequency?
1.
1. So there you go. That's half your answer right there. So what I'd like to do is let me start. Usually we'll demo both of these. So we can start with whoever wants E-stim or combo, ultrasound and E-stim to their upper trap. So whoever wants that, we're gonna start here. And actually, you know what, before we do that, let's go over, let me go grab my book. Let's go over indications and contraindications, because we have to add E-stim, so I wanna make sure, we already know ultrasound, correct? Because I don't know if the new legs are in more or whatever. I'm trying to like see
I like that shirt.
Rock Delta.
Yeah. Hungry.
Humble.
Always.
Probable. Yeah. It's the Rock's Under Armour one. Probable.
Rammable.
Probable.
Rockable. Oh, yeah.
All right, so why do you think, first of all, then we're gonna go on page 246. So why do you think we would use combo ultrasound?
Loosen up tight muscles.
Right, so when we use combo, the whole purpose is we want the effects of ultrasound and the E-stim to actually get the muscle to contract. So the big thing is to decrease pain and decrease muscle spasm. Are you also increasing circulation? Yes, you are, but those are the two main reasons, because what you're trying to do is you're getting the muscle to contract, just a slight contraction, so you're trying to fatigue it out. Those are the indications, basically. So your contraindications on 246, a pacemaker, and it's usually that demand pacemaker. It's a manufacturer that's been around forever, because the whole idea is that they're afraid the pacemaker will perceive the electrical impulses and change the setting on the pacemaker. Unstable cardiac arrhythmia is why. Mess with the heart, right? So if someone has stable arrhythmias or benign, I call them arrhythmias, you're fine. But if someone has uncontrolled arrhythmias, you need not be doing this. Yeah, absolutely, if it's not controlled.
Flutters.
Well, a lot of flutters are benign. So if it's more than benign, so hopefully if you have the type of arrhythmias where you've passed out, you need to get checked with that, or if you have any dizziness or lightheadedness, to me, that's an arrhythmia that needs to be checked out. A lot of flutters are just benign arrhythmias, and they're normal for most people. So over the carotid sinus, you don't want to do it over the carotid artery. If you have a blood clot, obviously you don't want to do it. You don't want to move the blood clot along the artery. It says over the pelvis, abdomen, and trunk or low back during pregnancy. That's nothing new. Precautions, cardiac disease in the essence that 1, arrhythmias, but 2, if someone had like peripheral arterial disease, you wouldn't want to contract over that because you don't want to close down the artery anymore. Impaired mentation or sensation, which is with every modality. A malignant tumor in the sense that if you put it right over where a tumor was, or someone that had metastases, the whole idea about increased circulation may feed a tumor. And a skin irritation or open wound, because this is not to be made, this modality, the purpose is not to do it over an open wound, where other electrical stimulation may be over an open wound. Make sense? All right, so who's gonna be our demo?
Rose wants the dough.
Who? Can you expose your upper trap?
Showing a little skin there.
Yeah, I'll send it to
Pull out that trap. On Trap City.
Alright,
you.
let's- And always check, these plugs always tend to get a little loose, so if you try turning the machine on and it doesn't turn on, obviously make sure it's the power's on, but check this plug. This was just a little bit loose because it gets pulled and everything. So let's give her a pillow.
I should say round of applause.
Do you have, what did you say?
I was thinking a round of applause.
Oh, do you have a problem with either trap, like tightness?
Tightness.
All right, more the left one, is that why you're?
Actually, want to do right.
Alright,
Because I'm a
so
righty.
I'm gonna turn, face Kim on the, we're gonna go this way. Yeah, so you need to think about draping, so, do you have anything for your ear, Rose? That someone can get you? It's very nice of you, Kim. So you wanna expose the area, and guess what about jewelry too, no jewelry in the area, right? So you wanna do the whole thing, you can feel me touching you, right? I don't see any wounds, I don't see any rashes. You would also precede that by telling her, so Rose, we're gonna do something called combo ultrasound to this right upper trap muscle. What it's gonna do is decrease some of the tightness that you're having and decrease some of the pain. Another indication could be it could increase her neck range of motion, right, if the trap was relaxed. So what would we ask her for precautions?
She's a pacemaker.
You have a pacemaker, that's big, so just like ultrasound with E-stim, that's one of the first questions, board stuff, right, Kim?
Any heart
Okay.
problems?
Unstable
If she's
arrhythmias.
any other type of unstable
No.
cardiac arrhythmias. Pregnant, she's over the upper trap, she's fine.
Any
Something
tumors?
that's not on there, huh?
Any malignancies?
Malignancy. Something that's not on there is with a lot of other E-stim, as I always ask if someone has a history of seizures. A lot of patients don't understand what epilepsy is, so I'll say, do you have a history of seizures? And then it's basically, it's more uncontrolled seizures. Seizures that are controlled, usually it's not a problem, but that's just something else to throw out there too. All right, so we've done the skin check, we've done positioning, so let's look at the machine and let's see what we need to do. So if you can't come, I can't see it, come closer. So remember how we put on sound, right, before? So we're gonna hit sound and we're gonna hit combo. So you want both the lights lit up because it's combo ultrasound, okay? Is everyone okay with that? So now you look at the settings on here and it's gonna tell you what to do. So let's go up to 8 minutes here, correct? All right, so now the first thing you do again is you just do the ultrasound piece to it, okay? So it's her upper trapezius, so what does this need to be set at? 3. And this is a chronic issue?
100%.
You said it's a chronic issue, I'm asking you? Yeah,
Oh, yeah.
right,
yeah.
it's been going on for a while, so then it can be continuous. And what should the intensity be?
100%. Continuous.
The intensity?
Oh, intensity
Wow.
on 1.0.
So can someone put it on 1.0 for me? Don't make that mistake on your test. All right. So now the ultrasound is all set, but
Is it the stim pad?
yeah, I just have to get the correct one. That's all right. So
Channel 1.
yeah, the one I want. So the other thing, let me show you. So there's 2 channels here on this machine, channel 1 and channel 2. So when I hit combo, can you guys see there's an orange light, and that's channel 1. That tells you I need to plug it into channel 1. Does everyone understand what I'm saying? So this goes, and the other thing, there we go. The other electrode that you need when you look for this, you need, and I'll pull this out so you can see from the beginning, you need a short one and a long one. Do you see the short one and the long one here together? You don't want one of these that has, they're the same length. This is for IFC. When we get to IFC, do you see that? So what you're looking for is a short one and a long one. Why?
Ground.
Because it doesn't matter, these colors, it doesn't matter. It was red, it has nothing to do with it. But the short one is gonna plug into the machine, the long one needs to go to the patient. So for the short one here, there's usually something on the side of these machines that say, see it says combo input, that's where it goes, and you press it in as hard as it can go. Looks like it's a little bit sticking out, but it's not. I can't press it in anymore. I think the other machine that Russ used may have the combo input in the back, so everyone's a little bit different. Okay. And the other thing we need to do, so remember I said you need 2 electrodes to complete a circuit. This is 1 electrode, this is gonna be her ground. So for these 3 machines, this one, the other one that looks like that, and the machine Russ had, you use this big pad. For the tall Chattanooga, we need to pull out, Kim, you wanna use little pads like that. Why? Because that's the manufacturer for that machine. So this needs to get hooked up. So you see there's a little hole that this goes into. You can't do something like this where the metal, I'm just trying to put where the metal's still showing. You need to really make sure you push this in as far as you possibly can. All right. And what we need, it looks clean, it should have all been cleaned when it was taken off the last person. So remember I said this, it says cleansing solution, so that's not an electrode spray. This is, it says electrode solution and skin prep. So this is gonna be the medium that's gonna have to go on here and have contact with her skin, all right? So if we're doing the right upper trap, in a moment, I'm gonna ask you to pull up your shirt. I'm gonna spray that, and I wanna keep it on the same side, so right upper trap, right low back, and I'm probably gonna tuck it into her pants a little bit, put it on her right side, not over her spine. Okay? So I'm gonna pull up your shirt just a little bit. So what I would do here, sorry, my cold hands, can you feel me touching you here? You wanna do a skin check. I don't see any rashes or anything here because you need to know to make sure that this didn't create a problem. So that makes sense, okay? And this is very cold. And we may need oh, you got the Velcro strap. So you just wanna make sure it's covered. Oh, I feel bad, Rose.
Okay.
It's really cold.
That's fine.
She's brave. Sometimes I tuck it in their pants a little bit and it just holds it, and again, I make sure it's not on her spine.
So that's
and,
not sticking to
and
the
can you,
skin.
no, so what I'm gonna do, because she's tiny, so you don't want areas where it's not attached, so hold on, I'm gonna do a Velcro. Here we go. Thank you. So I'm gonna pull this down. It's tough, it's tough. Huh?
It's like crazy how.
Yeah, so can you, and you can have your patient help. Oh, is that the, yeah, that's right. If you need help wrapping around, and I'm not gonna pull it like ridiculously tight like it's some corset, but you just want contact so it you know, goes to her, the contour of her body, that's all, and just sit back. So some of you may not need the Velcro strap, but what you tell, if you don't have a Velcro strap, just tell your patient, just sit back in the chair and don't come forward. So some of you may not need it, but she needs one.
Now, the difference
All right.
between that stim pad and those stim pads, those are self-adhesive, right? You
Yes,
don't, do you
and
need a
these-
medium still or no?
And these are only for the Chattanooga.
Yeah, you don't need a medium?
No, this is the only one that they recommend for that. Would I personally think that these are too small, and I think it should be a bigger pad, but I didn't manufacture it, but that's just my clinical experience with it. All right, so let's get the gel on.
And she doesn't feel anything from that pad, correct?
Now she doesn't feel anything because the machine's not turned on, but sometimes you may feel a slight tingling in that pad.
Okay.
More so with the smaller ones, I noticed.
Yeah.
I'm sorry, it didn't get
That's
warmed
essentially
up.
just a ground.
It's a ground, that's all it is. It's all it's meant to be, is a ground. All right, so, and again, and you know what, I'm gonna turn you a little bit. Yeah, 'cause and so you want to, it's cold, Rose.
It's okay.
All right. You just want to make sure that, again, you're in a good position so you can adjust this and do this at the same time. So you want to have enough gel on. The other thing is, you guys, we can relax your neck a minute. You guys need to know that we're looking for a motor point in the muscle. What's a motor point?
A shoulder blade?
No? It's a motor point when it comes to
Where the
E-stem.
nerve touches the muscle.
Where the nerve is most superficial in the muscle, yeah. So the upper trap motor point for most of you is gonna be, if this is the distal, it's gonna be more proximal right here, right at the curvature of the neck. So it's good to know because as you increase the intensity, you wanna be over the motor point. You don't wanna be down here, feels nothing, you're juicing it, you're juicing it, you're juicing it, all of a sudden, boom, there, she'll never let you do it again, okay? So what I'm gonna do is I'm gonna hit, so I've got the ultrasound all set. Does everyone agree with me? All right, so I'm gonna hit the start button. And when I hit the start button, do you see the green light under conductance is on? All right, so now Rose, what I'm going to do, relax your head and neck.
Is that the intensity from the OC?
Right now it's the intensity for the E-stem.
The E-stem.
So Rose, two things, the machine's not on yet, so, but I'm still moving it, right? So, what we're gonna do with the ultrasound after a couple of minutes, the only thing you should feel from the ultrasound is a light warmth. If you feel it hot, burning, any discomfort, you're gonna let me know, okay? So now I'm gonna increase the E-stem 1 milliamp at a time. First you might feel some tingling, all right, and let me know, and then you're gonna feel just a slight muscle contraction or twitch. All right, can I go
Okay.
up again? Stop
Yeah.
turning your neck, because you really don't turn it anymore. You'll be able to see it again. Do you feel anything there?
No.
Because a lot of times at 3, students will feel it, so. And sometimes once the ultrasound heats up a little bit, they'll feel it also, so.
It feels similar to just normal E-stem, just kind of strong.
Not yet? Nothing?
No.
Oh,
I
there we
feel
go.
it.
I see it, so. Can you see the little twitch? Watch when I go up again. Very light, see it?
No.
Watch. Watch when I go up. See
Oh,
it?
yeah, I see it.
That's all you want. So I'm gonna hit start, and now the timer will start, and so now the ultrasound is on. There, see it?
What twitch though?
There,
Where?
there it is. Watch it.
Oh, in the gel?
See the
No,
muscle
in
contract.
the muscle. You see the muscle. You still okay,
Oh.
Rose?
Mm-hmm.
Yeah,
Oh,
and that's,
wow.
that's,
That looks like a.
and I'm just gonna get the gel. And it's actually gotten a little stronger because as the ultrasound heats up, I have a thermal setting, you might be able to feel it a
Does
little
it feel
more.
good?
It feels weird because my muscles like,
Contracting?
yeah.
So you want it on just a slight contraction, a comfortable one. Do you see it's getting
It's like
stronger?
moving your shoulder too.
You want me to try? Let me try turning it down
It's
one.
so weird.
I turned it down one just to see, because it actually got stronger as we went along. Relax your neck.
It's really weird having your muscle move without. I know, without moving it.
Do you still feel it slightly?
Mhm.
Oh, here it is. Yeah, so see, I had to turn it down one because I thought it was just getting a little bit too strong. And I want it comfortable, that's the key. Yeah, so she's only on 3 milliamps. So how does the ultrasound feel? Do you feel any warmth?
warmth.
Huh?
Yeah, I feel some warmth.
Do you want a little warmer?
Sure.
All right, so I was hoping you'd say that so I can show them how to do that. So I can't increase this. This could potentially be a safety issue if you increase that because that's conductance. And the E-stem, I already said, is good enough at number 3. So if I want to go back to the ultrasound intensity, I hit the toggle button, which is CH. Do you see it goes back to 1.0 watts per centimeter squared? And I'm going to do that.
Yep, I feel it warmer.
Okay, if it's too hot, let me know. Same thing, if I gotta go back and change the E-stem, I'm not changing anything, Rose, I'm just showing them. I would go there and put it up or down. And that's plenty strong. Is it still comfortable?
Mm-hmm.
And so the whole purpose is to get a muscle twitch. If you can't get a muscle twitch or they're saying, oh, I don't like the way it feels, why are you doing combo ultrasound? You need just to do regular ultrasound. So the whole idea is to get that muscle to contract, which will fatigue it out. Make sense?
Do you feel good?
Yeah.
There's a very slight twitch, I see. which is fine, that's all you want. And like I said, the more it warms up, that's why it got a little stronger and I put it down. And then, so a lot of it's really like an ultrasound treatment. The trick is, as you're adjusting the parameters, you have to keep this moving at the same time, and that's the hardest thing to do with students. Yeah. So I'm just gonna stop it. Okay. So, paper towels. Sorry. So what did you think, really? What did you think of it?
I liked it. It was
You
cool
liked it?
to see like Cecilia Pickle have
You
a
have to watch
kind
the
of
video.
fashion.
Looks creepy.
But you see how you have to be very careful and just go up slowly. You can grab me that other paper towel. And I don't know if you guys noticed who was close by, but when you get to the conductance, you have to hit each button twice before it will go up, because I don't want someone just walking by and accidentally touching the machine and all of a sudden you're jacking up the juice. This is AC current, alternating current. You can get me a couple more, which is the most common type of current in clinic. Well, we haven't gotten to DC yet. AC is the most comfortable. Thanks. And so this is a time I could do a stretch if I've warmed up her muscle, right? And I would do my skin check. You can still feel me touching you, right? And sometimes it might look a little pink. Okay, and if she needs more, then sometimes they'll wipe themselves off with a towel too.
Or not at all, they'll just slap your clothes back on and then send you on your way.
Oh, you mean the therapist, yeah. So just lean forward, Rose. Okay, so that's the upper trap. So the only other muscle that you're responsible for is rhomboid. So I do that prone to relax the muscle. So I need someone who's willing to do